Overlooking the Castries waterfront is Victoria Hospital, an institution that has served St. Lucia well dating back to 1887, a distinction celebrated in local culture.
Goodbye, Victoria. Yes, we love you. We will really miss you. Goodbye.
The need for a new hospital has been identified by all administrations. In fact, it was part of the St. Lucia Labour Party manifesto way back in 1979.
The then manifesto of the Labour Party was largely crafted by me and George Odlum. George Odlum wrote about the personalities, did the bio on the candidates then, and I virtually fashioned the policies. And way back in 1979, I had inserted in the then manifesto of the Labour Party a section dealing with healthcare and proposed that a new Labour government would construct a new hospital.
It did not happen then in 1979, and although the dream was entertained by former Minister of Health Romanus Lancico years later, he only succeeded in building an extension to the aging Victoria Hospital. There were many improvements to the national healthcare system, but it was still not living up to the expectations of a more demanding population.
Clearly the motivation was to provide the people of St. Lucia with a new modern hospital, because Victoria Hospital could not take us into this new century. Medicine has changed dramatically, technology had changed dramatically, and we needed to adapt.
Many discussions, and many years later, health officials have embarked on a comprehensive health reform agenda. Eventually, a white paper was developed on the way forward.
This white paper has really been the driving force for the health system. It has really defined the health system agenda. It has defined the health sector reform process back in 1998.
This white paper listed 3 broad areas for attention: institutional strengthening, universal health care, and infrastructural development.
The infrastructure development has been supported by the new national hospital infrastructure as well as other health facilities in the community. The institutional strengthening included the quality management systems, the health information systems, the governance structures, as well as the human resource development issues.
This was the greatest responsibility of the Ministry of Health, Wellness, Human Services, and Gender Relations.
Our policy thrust is to strengthen the primary health care so that as many persons as possible could benefit from quality health services.
This comprehensive health reform project was meant to guarantee that quality health services were within easy reach of the entire population.
The mandate or the role of the health sector is to make sure that we provide health services that are affordable, that are accessible, and of course that are excellent and delivered in a very conducive environment. That is the mantra really of the Ministry of Health. And along with that, to ensure that we lead the population in the area of health promotion and prevention of diseases. That is paramount.
One of the strategies that the ministry is employing to ensure that we can improve access to service is universal health coverage. Universal health coverage builds on a principle of solidarity where all individuals can make a contribution to their health services.
Inevitably, a new national hospital became an integral part of the reform and modernization of the health sector in St. Lucia.
Healthcare is not just about constructing new buildings. It is about new technology. It is also about new professional expertise, but critically and crucially, it is also about the quality of decision making within the healthcare system.
Now, St. Lucia is well on its way to having a state-of-the-art hospital. The new national hospital has become a reality, one made possible by extensive financial support from the European Union. The negotiation process began way back in 1996. After a few design amendments, St. Lucia now has a brand new hospital costing over 175 million EC dollars. Out of that amount, the government of St. Lucia is contributing over $35 million and the European Union an unprecedented $140 million.
And they are very fond of reminding me that that is the largest investment they have ever made in a single country in the Caribbean. And further, that it is unlikely that we will ever see such an investment again.
St. Lucia had to convince the European Union that the Victoria Hospital could not be further enhanced to meet the medical needs of an expanding population. In early 2013, a delegation from the European Union arrived in St. Lucia to see firsthand how the record amounts of European Union funds were being put to use.
The hospital that we're visiting today is in fact the single largest investment that the EU has made in the Caribbean on an infrastructure project like this. And we are very proud of it because, as you can see, it's a very impressive hospital.
The St. Lucia New National Hospital is itself a monumental undertaking. It is designed with 4 wings fanning out from the main building. Each wing stands on its own to avoid a domino effect in the event of an earthquake. On the inside, each wing is color-coded for easy navigation by staff and patients.
This building is designed to be the last building standing, really.
The new National Hospital is also eco-friendly, designed to be cooled by directing the trade winds through a configuration of windows and vents.
And for the wards, it's been designed with these brise-soleil to block out the glare of the sun. And the windows are designed as a double window which allows an air movement and across the building. So the windows are intended to be open unless you've got extreme storms.
One of the cost-saving features of the new National Hospital ensures that the building is easy to maintain. There are no hard-to-reach areas.
You need to have a building that is easily maintained like this one. This one's designed to the state of the art, the most up-to-date regulations that one can have and design processes.
The new National Hospital now has a capacity of 116 beds and comprises maternity and delivery suites, 4 operating theaters including day surgery, dialysis unit, physiotherapy suite, outpatient services, radiology suites, intensive care unit, pathology laboratory, and mortuary departments. The equipment for the new National Hospital will meet 21st century standards, a point emphasized by the European Union ambassador.
The equipment opens up a whole new range of issues that are to deal with maintenance and with training, because the personnel has to be trained in order to deal with the latest machinery. We're talking about the state-of-the-art radiology machines that are coming in here.
The new National Hospital is not going to operate as a standalone facility. In fact, it is a flagship medical institution, part of a nationwide network of health and wellness centers and polyclinics, each well-equipped and serviced by highly trained and motivated staff. The objective here is to ensure that all medical staff are trained to deliver quality service at every health facility around the island.
It is paramount that any health sector has to be well equipped with well-trained, motivated staff members, medical personnel, clinical, and the like.
The health centers have now been equipped with the resources to diagnose and treat most medical issues and are highly recommended as the first point of contact for anyone requiring medical attention.
The primary health care is the backbone of the health sector. It feeds and supports the new national hospital and the polyclinics and other facilities. And we want to ensure that persons within the communities have access to health care services at the community level, whether it's for prevention, early detection and screening, and also to help manage the various conditions that the population suffer with. So across the island, we have about 33 health centers and we have polyclinics as well. And we are continuing to assess the situations at those facilities.
We provide many services there. We have services for all age ranges, and the services are heavily subsidized, so it's practically free. You don't have to pay to see a doctor at the health centers.
The Grosley Polyclinic, for example, now operates for extended hours.
We can certainly say that persons are utilizing the service. We have definitely noticed an increase in the numbers of persons accessing the Grosley Polyclinic.
There have been many improvements in the service delivery of all primary health care facilities. The Ministry of Health plans to establish polyclinics at strategic points around the island, which offer advanced medical services.
We're thinking of radiological services, X-ray being available. We're thinking of blood investigations being available. And we're also, in the polyclinics, we also have some specialist care. So you may have a pediatrician doing some visits there. You may have an obstetric and gynecologist coming there. You may have a dermatologist visiting as well to provide some of those services.
The success of the Grosley Polyclinic has served as a benchmark for implementing a similar institution in the Dennery area, while in Soufriere, the hospital has been earmarked for a major upgrade and redesignation as a polyclinic. Over in Castries, a major change is coming.
In the first place, the Castries Health Center, which is in a dilapidated state, will be decommissioned. And in its place, we will have instead a polyclinic opened at the Old Victoria site, which will be an urban polyclinic serving the Castries Basin.
This new facility, called the Castries Urban Polyclinic, will be supported by health centers at Entrepot and La Clery. With all medical facilities being developed to provide world-class medical service, the drive by the Ministry of Health is to get the public hospitals accredited.
Important for us, because when we look at standards, we want to make sure that we receive at our major hospital, St. Jude and New National Hospital, international accreditation to make sure that we have international standards. Whatever we do here in St. Lucia could be on par with any hospital, national hospital, anywhere in the world. That comes at a cost, of course, but this is what we want for the people of St. Lucia.
Healthcare financing comes at a tremendous cost to the government of St. Lucia.
We have to meet the cost of providing health care. It is clear that the current model does not work. It is pointless to have a modern hospital and people can't access it, people can't get health care. And so very soon we will need to engage in a huge conversation, a big dialogue about financing our health care needs and health care priorities.
Although a developing country has the duty to provide quality medical services, personal responsibility is the proven way of keeping down health costs and increasing productivity.
And so it is our responsibility, as well as the other sister agencies and ministries like education, agriculture, youth and sports, to assist us in bringing this message forward.
The Ministry of Health, Wellness, Human Services and Gender Relations is enlisting the entire population, institutions and the private sector in promoting the concept of a healthy lifestyle. Brand new hospitals in the north and south of St. Lucia and a string of satellite health facilities will position our island as a leader in healthcare delivery in the Caribbean. There is a lot to be proud of. The new health service in St. Lucia is being developed at an advanced rate, The European Union has now adopted the new National Hospital as a signature project.
We decided on this project no less than 10 years ago, when the government realized that the former hospital, the Victoria Hospital, which actually opened in 1887, was not going to make it into the 21st century.
The staff at Victoria Hospital is energized. The idea of moving into an improved surrounding, looking at our services and setting up new approaches have sort of encouraged the staff to work as greater teamwork is encouraged. We have a lot of team building exercises. We also have a lot of training undertaken, leadership training, customer service training, as well as other areas of training to develop capacity in delivering service.
A modernized healthcare system should also be a source of pride for all St. Lucians, especially those who have had to travel overseas in search of medical assistance.
But I'm happy that the dream has come to life, that finally the people of St. Lucia would have a brand new hospital. We'd have to take care of it. But what brings me considerable satisfaction is the fact that St. Lucia will have a very modern healthcare infrastructure, meaning you now have a new psychiatric hospital. You now have a new national hospital. And despite the fact that disaster created the situation in Gay 4, yes, you know, a disastrous fire virtually destroyed St. Jude Hospital. When that is completed, then we're going to have another new hospital, because St. Jude is going to be a new hospital for all practical purposes.
After more than 180 years of service from the Victoria Hospital, the Ministry of Health is ushering in a brand new facility engineered to the highest global standards in construction, technologies and management systems. The new National Hospital is equipped to provide a variety of quality services. This is the beginning of a new era for health and wellness in St. Lucia.